and welcome back to Contemporary Black Voices, where our discussion today concerns the controversy on the reclassification of nurses from professional to non-professional. And our guest today is Manara Small, who is a nurse and a student in Houston who has a lot of information on this. Manara, one of the things you discussed on your Facebook post is the limitations to care,
Yes.
especially in the Black community and in the rural community. Could you elaborate more on that?
In rural or underserved areas, nurse practitioners and advanced practicing nurses are really where they do most of their work. Um, what's very concerning and alarming about this right now is, in addition to them wanting to reclassify these degrees, is that in January, a lot of the changes to the Medicaid and Medicare program are going to happen.
Mm.
A lot of rural clinics, hospitals, and public resources in terms of healthcare are going to be depleted. They will not be available anymore. Advanced practicing nurses, nurse practitioners, doctorates of nurse practitioners. These are the people who are serving those areas. If we're eliminating all of these different things pertaining to nursing all at the same time, what you are going to see is the healthcare system is going to bust. Everybody that's in those areas that are already underserved, you're going to find that those people are going to move towards areas that do have services. The only problem is because of the types of changes that they're making to the laws, it's no longer going to be a case of, yes, we have to treat everyone. It will be solely contingent on what type of insurance do you have. Now, those of us who are either going to become advanced practicing nurses or are already advanced practicing nurses, the change in that is that a lot of people are not going to get health care. And there will be providers and nurses who will have to make choices of prioritizing who to take care of based off of the fatality to non-fatality issue. That is something that as nurses, we do not ever strive to do.
So you're talking about that there's changes being made to Medicare and Medicaid. Could you give us an example of one of those changes?
Well, what they're doing is they are depleting a lot of the money that is going into the program. Um, and they're quoting it as it's not necessary. You don't need it. You've probably heard a lot of it in reference to like SNAP. What a lot of people in this country don't know is that Medicare and Medicaid subsidize so much more than just health care. It subsidized work, transition to work programs. It subsidized SNAP. It subsidized a lot of educational and healthcare resources that are in the very areas that you're asking me about. So if they're going to cut the funding, basically just take the surplus money that's there, then you're not going to have those resources. And it's basically a trickle down effect. This whole conversation that is being had and both of these things happening at the same time for millions of people who are out there depending on healthcare and medication, it is not a very good look at all. As nurses, we are now going to be faced with making choices that you normally would not have to make unless it was like wartime and you're in the trenches, someone coming to a facility and you having to make the decision as to how you're going to render aid and care to them based off of either what they have or they don't have in coverage, or even if that facility is available and open.
I know that one of the areas of that they have cut is access to long-term, no, not dental care requiring medical services such as dentures, any type of advanced surgery. So you have to contact the insurance company to get an add-on for those type of services, because if you don't have it come January, and that might be your day for a root canal, it won't happen.
So what is happening is just like in our workforce, the baby boomers are the largest population in this country right now in terms of retiring. They have paid a lot of money into the Social Security, the Medicare, and the Medicaid system. It is now time for them to be able to receive those benefits. That is a large amount of money. It is no coincidence that these laws are being written at the same time that this age group is retiring out. If we can change these laws and it's directly affecting what we will either pay out or give to them, then we don't have to. If you don't have the nurses or the healthcare systems to take care of them, then they expire.
Mm. Mario?
Just if I could, I know you mentioned in the very beginning about the culture involved in with black nurses and stuff. Could you maybe expand a little bit on that? Because I do know that black women have always had a little bit more insight in terms of the body than most
Yes.
guys do. And so that's an important component. But the cultural aspect of that, could you comment a little bit more on that?
Yes. So there is this very happy fairy tale about Florence Nightingale and nursing, and yeah. This is America, and everything was very separate a long time, not too long ago. And there were separate hospitals, there were separate doctors, there were separate nurses. So the whole separation of a licensed vocational nurse and a registered nurse is rooted in that very same racism. Um, Black nurses were taught in their own nursing facilities, and they practiced in the Black hospitals and clinics. Now, the caveat to that is that, as everyone knows, they were very good at their jobs, exceptionally good at their jobs. Most of the quality nursing programs were rooted in the HBCUs, St. Philip's, Prairie View. And these nursing programs are still heralded as some of the top nursing programs in the country. The reason being, which goes to what culturally our community has always had to do. We have to be 10 times better just to be average. And once the playing field was opened up to where Black nurses, male or female, could aspire to be a higher degree nurse, an advanced practicing nurse, then it exploded. But the degree program straight across the educational system, you will see Black women are at the top of the list. They are the most credentialed, they are the most degreed. And so, what I have been advocating is, I know this classification and reclassification, it can be a little confusing, and we understand what's at play here. They're trying to take the money. But this is an opportunity for us to not feed into the smoking mirrors and pay attention to the distraction and the deterrence, because ultimately that's what's at play here. They do not like the idea that we are the most educated, most degreed and credentialed. That's a fact. They don't.
Mm.
The other thing is that we have the ability to continue our education, and it's going to be a little uncomfortable. Yeah, we may have to take a little longer in getting the degrees, but my advocacy for other nurses, especially Black nurses, remember those nurses who started out with Artemisia Bowden at St. Philip's. Remember those nurses who started out in Prairie View. They didn't have a fourth of what we have.
Amen.
The grant programs and all of that, it wasn't in play for them until the latter 60s and when integration and the Civil Rights Act was passed. So hundreds of those nurses came before us and they laid the foundation for what we study and aspire to reach to.
What we're going to
It
do
doesn't,
is we're going to take a break and we're going to come back. So remember where you left off.
okay.